Assalamu alaikum. Hello, everybody. This is a presentation of pathophysiology of dry eye syndrome. And I claim no financial interest in any of the products that might be demonstrated in this presentation or otherwise. Starting by the basic anatomy of the lacrimal system, we are all aware of the fact that the lacrimal system is composed of two parts: the secreting part, which comprises the lacrimal gland, the major lacrimal gland, as well as the minor accessory lacrimal glands scattered in the conjunctiva. This lacrimal gland secretes via many ducts that open into the upper lateral fornix, where the water component of the tear film, as we will see later, is passing through the conjunctival sac. And the second part is the draining part, which drains the tear film into the nose. The draining part is composed of the papilla with the punctum in its center, with the canaliculi, upper and lower ones, which unite together to form the common canaliculus that opens into the lacrimal sac, extending into the nasolacrimal duct, opening into the lateral wall of the nose below the inferior concha. The circulation of tears is a dynamic process that's going on all the time, enhanced by blinking and affected by the contractions of the pars lacrimalis of the orbicularis muscle. Now this process is under neurological control from the autonomic system, as well as some sensations and reflex effect. The parasympathetic system gives secretomotor fibers that pass and relay in the pterygopalatine ganglion, and the sympathetic system gives vasomotor fibers that relay in the superior cervical ganglion and pass via the nerve of the pterygoid canal and the deep petrosal nerve into the lacrimal gland. Sensory innervation is coming from the trigeminal ganglion and passes through the maxillary nerve. Now the tear film is composed, as you're all aware, of three layers. The innermost is the mucin layer formed by the goblet cells in the conjunctiva. The middle is the water layer formed by the main lacrimal gland mainly, and the outer one is oil. Mucin layer helps in decreasing the surface tension that is normally existent between water and the surface of the eye, and this helps the spread or the resurfacing of the water layer then to be covered by the oil secretion from the meibomian glands in both the upper and lower lids. This helps in preventing evaporation. This is number one, and helps as well in the motility and lubricating the motility of the upper eyelid. Again, here's the outer lipid layer formed from the meibomian glands, the middle from the main and accessory lacrimal glands, and the inner from the goblet cells. This is what is called ocular resurfacing, which is a very important process for the vitality of the cornea and hence the whole eye. What is dry eye syndrome? By definition, dry eye syndrome is an ocular surface condition caused by tear deficiency and or tear excessive evaporation. That is, it might be a mere tear deficiency or a mere excessive evaporation or a combination of both. Effective resurfacing that I talked about a few moments ago requires normal blink reflex, that is muscle and nerve activity, requires congruity between the ocular surface and the eyelids, that is not interrupted by conditions like ectropion or entropion, and requires a normal corneal epithelium that is not affected by disease. Epidemiologically speaking, the data are limited, and there is no consensus worldwide on how much of the population is affected by dry eye syndrome. But it is said that it is more in men than in women, probably due to more exposure of men to conditions of outdoor work. It increases by age, where a 19% incidence is compared to something like 8.4% incidence before and after the age of 60. The average is around 15% of the population. So the condition is probably the most frequent ophthalmic condition. It is a very common disease or an abnormality. It's predisposed to by conditions like rheumatoid arthritis. This is well known to all of us. Smoking, we tend to forget. Exaggerated by hormone replacement therapy in ladies in the post-menopausal age. Local medications, especially with the local high alcohols as preservatives, may cause, again, or predispose to dry eye syndrome, and the wear of contact lenses disrupts the circulation of the tear film, and again, might predispose to dry eye syndrome. There are some factors that interplay in the pathogenesis, and these include immunological conditions that are playing locally in the ocular surface, with an inflammatory process as well, in which cytokines, specifically interleukin-1, is playing a role. There are some activations of some cell markers. There is an apoptotic activity of some cell markers, and there are receptor molecules on some cells. I know that this is a big jargon of names, but we can simply say it is a process of inflammation that is mediated immunologically with a congenitally determined apoptotic activity. What happens? The osmolarity is increased simply because of the evaporation and the loss of the solute, the dissolving water. The mucin are decreased. Tear viscosity is thus reduced. This compromises the epithelial health, and fat is emulsified. Let's see how tear deficiency may occur. It may occur due to a disease in the lacrimal tissue itself, that is the main lacrimal gland. May occur to a disease due to a disease in the conjunctiva, or due to lacrimal gland atrophy. The tissue of the conjunctiva and the lacrimal gland might be affected by diseases like trachoma, which is common in our country, still common, by the way, tumors, sarcoid, or other inflammatory immune-mediated reactions. The conjunctiva might undergo obstruction of the gland pores due to trachoma, burns, or autoimmune diseases. The lacrimal gland might be congenitally absent, which is a rare condition. Pure keratoconjunctivitis sicca, which is pure decrease in the secretion, as we said in the definition, or Svigren syndrome. Excessive evaporation may occur in conditions of exposure, more exposure, like leg ophthalmos, blepharitis, meibomian gland dysfunction, oil deficiency, or contact lens wear. Abnormality in blinking, for example, essential blepharospasm, or environmental. And we shouldn't forget here smoking and exposure to outdoor conditions, sun, dryness, and so on. Thank you very much.